It is a great pleasure to introduce to you Dr. Cindy Walker. Cindy came into the University of Wisconsin at Milwaukee when I was a professor there, and I was so excited when she came in. She's one of those, well, one thing you're going to find out right away, she's fiery. She's intense and passionate about data, but what she's really intense about is for us to get it right, and she has the ability to translate it in a way to help us understand. And it's that quality that was what we were looking for, that translatability, that she's going to help us throughout this whole project for the next 3 years. She's our consultant to help us figure out how can we help our school teams understand this, how can we help engage them in this process, how can we help translate it not only this way, but we also have to translate up. Policymakers need data in a way that they can understand, and they need to have it done right so that when people start to question and challenge, we can point to validity, we can point to reliability, but also what her talk today is really going to be also about is conceptually we can explain it in a way that makes sense, has good, strong theory, and an obvious applicability when we look at it. So it's really awesome that we have someone like Cindy coming up today to talk. She works with data and big data systems and all the big things that go on around data and assessments. She knows all of those things, and she's going to bring it down today to talk to us just about the survey components and how we might design it. So, Cindy, thank you.
Thank you, Scott. I told Scott that I was going to start trying to explain to all of you that I'm here sort of for the past 2 days doing what all of you are doing, which is trying to figure out how I fit within the whole process. So I've been able to come around to some of your teams and hear what's going on, and I'm really excited. It's a very exciting project. I think I just told Chad, it's like Scott has taken what he did at Milwaukee and he's scaled it up to a nationwide project. It's very exciting. So my background, as Scott said, is I was trained in quantitative research methods at Urbana-Champaign. I consider myself more of a psychometrician than a statistician, but I teach both. I have background in math and in math education, and I've always been very passionate about improving our educational system. I've worked with nonprofits to develop scales like I'm going to talk about. I've worked with medical physicians to develop measures of health literacy. I serve on the National Council of Measurement and Education Board. So I'm really into measurement. So when Scott asked me if I could put together a 45-minute talk on scale development, I'm like, well, I teach a whole class that I developed on it. So I've taken my class notes and tried to condense it into what I hope will be about 45 minutes. There may be some technical things in here that you might not care about. There may be some things in here that you already know about. I'll try and also sort of, as I'm going through the slides, tell you a little bit about my experiences in working with students and community partners, really, in sort of developing measures. Down, okay, and I'm not used to a Mac either. So here's just an overview of my talk. I won't read that for the sake of time. But we're going to start with talking about what measurement in the social sciences is. So when you talk about measurement in the social sciences, you really have to think about constructs, because measurement is really fundamental to everything that we do. When I started off in my doctoral program, it actually was a continuation of this silly little project I did as a master's student in my math ed program, where everything that I measured was ridiculous. I mean, just ridiculous. And I had all this data, and I went through all this time to collect it, and it was actually for a multivariate stats class, and nothing turned out statistically significant. And then I went into another class, and they, again, wanted us to do a project, and I'm like, well, I have all this data. I spent all this time collecting all this data. And the professor said, that is a case of measurement error. And I'm like, measurement error, what is that? You know, I mean, we talk about the error term when we talk about statistics, so I knew about it and I'd heard about it, but I didn't really know what it was. So he allowed me for my class project to study classical test theory sort of on my own. So that's where I got all interested in this, because I think so often in our stat courses, we teach a lot about the statistical concepts, but we just give people data. And we don't really ask them to think about how would you collect that on your own. And if you're not collecting the data well, then the results that you're going to get from the statistics mean nothing. So why do you need to develop your own scales? Well, either because there's nothing out there that exists to measure what you want to measure, or because the things that are out there that do exist aren't good enough for your purposes. I can't tell you how many times I've sat on dissertation committees for students, graduate students, and they tell me that, well, I have to use this measure. This is what's used in the field. And I'm like, but that item's really bad. I mean, I can just tell it's bad. Nobody's going to answer it right. Well, I can't change it. This is what's been validated. Well, yes, you can, but then you just have to go through the psychometric analyses on your own to show that you're still measuring what you need to measure. So this is just a figure of the scale development cycle, and as you can see, it starts out with a construct map, and we've heard a lot about constructs as we've been here today. And then it goes into the item development phase, and then you take those item level scores. So what I'm going to talk about here is taking item level scores to create variables that are continuous, not just looking at item level analyses, which is something that people really like to do, that I try and tell them that it's not appropriate to do. So scale development is based, as I already said, on differentiating between levels of some construct. And I think, does everyone know what a construct is? It's something like self-esteem. We've heard about soft skills, or we've given it different names, but it's those socio-emotional things. It's something where someone's self-reporting to you, something about their cognition. It's usually assumed to be continuous and extend from from weak to strong, high to low. And what you're really trying to do when you create a scale is to maximize the variability on those item level scores, so you can maximize the variability, so you can run a statistical analysis that makes sense. You can have a single underlying construct, but you can also have subscales of that construct. And when I teach this class, I make my students actually develop subscales and then try and test them out, and they have to go collect data and all that kind of good stuff. So when you're defining the construct, a construct map can really help you to try and conceptualize what the construct's all about. And this is actually the first homework assignment in my class, and I make my students really come up with a construct definition, and then they have to tell me what respondents would be like that are very high on that construct, and what respondents would be like that are very low on that construct, and what characteristics would respondents have that are sort of in the mid-range of that construct. They always get very confused about sort of what the item response is, what that should be, and that typically actually relates to your response scale. I mean, you can actually differentiate amongst the behaviors in terms of your response scale. So this is something that you could use with your districts or use in your teams to try and help think through actually what it is. I can tell you that when I worked with a bunch of physicians, we spent 2 full days really talking about and thinking through what the construct of health numeracy was, what our definition was. We wanted to make sure we were all on target about it, or on the same page. So that's the first step, is to create a working definition that's grounded in the literature and in your own understanding. It's really, really important to come up with that working definition before you start developing any measure. I mean, I know it's common. People sometimes think that you can just throw a bunch of items together and that's going to be a great measure, but you really need to think about what the construct is first. So with those medical physicians, I already told you that. So guidelines for helping your teams develop a construct map include thinking of the extremes, what makes someone high and low on whatever you're trying to measure, and developing descriptions of those extremes, and then developing things in the middle. So when you're thinking about the construct, you want to think about whether or not it's going to be defined in terms of the behaviors of the respondents or in terms of their responses to items. Eventually, you need those two things to come together, but usually it makes sense to think of one of those things first. And we oftentimes refer to construct as latent variables, and we heard some talk about structural equation modeling earlier. A lot of times structural equation modeling is used to actually do confirmatory factor analysis, which we'll talk about towards the end of this talk. Constructs are often referred to latent variables because it's presumed that it's the latent variable that causes one to respond in a particular way to items. I also have my students in that class come up with a path diagram, which, for those of you who know structural equation modeling, this will be familiar to you. In this particular example, I've defined a construct called job satisfaction, and then I've broken it down into subcomponents. So what are the things that one would be satisfied with if one were really satisfied with their job? So they might be satisfied with benefits, they might be satisfied with their colleagues, with their administration, with opportunities for growth. They might be satisfied with intellectual stimulation. Obviously, if someone is satisfied with all of those things, they're going to be very satisfied with their job. If someone is satisfied with only some of those things, they're not going to be as satisfied as someone who's satisfied with all of those things. So that's sort of the way you think about it. And then you'll also notice that there's an error term, because there's always measurement error in anything that we're trying to measure, and that's what we're trying to minimize. So all measurement has error associated with it. We assume that that is residual error, that it's randomly, it has a mean of 0 and is not caused by differences in the construct or differences that you haven't included in the model. We assume that it varies randomly and when aggregated among respondents, meaning that it has a mean of 0. And it's further assumed that the residuals are not correlated with each other or correlated with the true scores of the construct. So what that means is that you want to make sure that there's not a reason that your items, that you have error. You want to make sure that the error is random. In other words, there's no reason that you haven't asked things a particular way or something that could be causing people to not be responding to your items correctly. Am I? Okay, no, this is right. I'm sorry, I'm on a Mac here, so I'm not familiar with the Mac. But so then the next thing that you want to do is, after you've clearly defined what you want to measure with your construct map, is to start defining your item pool. And theoretically, a good item pool is bigger than you really want your measure to be, because at that point, you don't really know if your items are going to be functioning properly. No matter how many steps you take to ensure that your measurement has less error associated with it, at this point, it's not until you actually collect data and do the statistical analyses that you'll know if your items have good psychometric properties. So at this point, redundancy is sort of a good thing, because redundancy, as you'll see later when we look at reliability, leads to an increase in your reliability coefficient, which leads to a decrease in your measurement error. So there should be considerably more items in your pool than you want on your final scale. So these item writing rules really pertain both to measurement on measuring a construct, a latent variable, or survey development. I mean, I do both. I mean, there's sometimes when I just develop surveys where I'm really only interested in people's responses, what percentage of people agreed or disagreed or felt a particular way about something. These are just general item writing rules. They would be in any general measurement course. So you really want to avoid items that are exceptionally long. Because if your item is too complex, you don't know if people are going to interpret it in the same way. I mean, no matter when I say this, my students, I will see ands and ors in their statement. I just circle them. I'm like, nope, that's two statements. Nope, that's two. No, that's two. You want to write items at an appropriate reading level. Typically, the rule of thumb is 5th or 6th grade, but it's depending on your population of respondents that you're going to administer it to. Again, avoid items that convey more than one idea, and really that has to do with ands and ors. Avoid ambiguities. Seems kind of common sense. I know that people a lot of times like to mix up positively and negatively phrased items, but in my experience, it's typically those negatively phrased items that turn out not to be working properly. And I think the reason for this is the last bullet point here, which says avoid double negatives. So we sort of all know what that is. And again, when I teach this in my class and I tell my students this, it's inevitable that a large percentage of them will have items that have a not or never in it. And then in their response scale, they have something like never or disagree. So that double negative doesn't only pertain to the item stem itself, it also pertains to how the item stem relates to your response options. And you know, it's just something that people don't think of, and when they I always tell my students not to just put a not or never in there. If you can think of a way to phrase something that's negatively phrased, but it doesn't have not or never, I mean, it's like the opposite end of the continuum of the construct map that you've defined, then it's probably okay. It's just when you put in nots and nevers and you just try and make things sort of awkwardly negative that things seem to not work properly from a psychometric perspective. So when you develop your response options, it's really desirable to maximize the variability, and I've already said that earlier, because you can't look at the covariance of your measure with something if there's not variability. And this is another thing when I'm reviewing my students' items, or a client or one of my people that I'm consulting with, an organization I'm consulting with, when I look at their items, I really try and make sure that everyone isn't going to really agree with the item or really disagree with the item. You really have to think through that. Is this something that some people might say, yeah, no, I don't feel that way. Yeah, I really feel that way. Or is this something that everyone's going to agree with? If it's something that everyone's going to agree or disagree with, it's not adding anything to the variability of your measure, so it's not a good item. The only way to maximize the variability is to make sure that you have, at your scale level, is to make sure that you have variability at the item level. The other thing when you're thinking about response options is you can also maximize variability by having more response options. So having more response options is good as long as everyone's going to be looking at those response options in the same way, and two response options don't really mean the same thing, like somewhat or maybe. I mean, those two terms are very similar, and so people may be using them differently. You may be differentiating amongst those responses numerically, but really there's no difference in terms of the person's cognition. This sounds like an obvious one, but I have worked with school districts where honestly they have not let me look at their survey before they've sent it out, and I've looked at the response scale and it has not been in the right order. So it totally confuses the respondents. I mean, for us, I think that's normal, but it's just for people that aren't used to doing this, that's not always common sense. They just think of the response options and put them down. It's important to order them in the continuum of your scale. I sort of already said this, to use response options that are easy to differentiate. And then think really carefully about whether or not you want a neutral response on your scale. I actually prefer not to use a neutral category unless there's something that, like a don't know category, someone couldn't answer it, because I like to sort of force respondents to choose between the positive and the negative end of the continuum. And again, I sort of said this earlier, but make sure that your response options really reflect differences in the construct. Oh, the other thing is that it's not really necessary to use the same response scale for every single item on your measure if it doesn't make sense. You can mix things up. If you have a frequency response scale for some things, an agreement scale for other things, that's fine. The one thing I probably would do, though, is to make sure that you have the same number of response options for everything, because if you don't, you're going to actually be weighting those items that have more response options heavier in your overall score, right, because they're worth more points than you would for items that have less response options. So what do you do once you've developed your items? It's really important to have them reviewed. So you can have them reviewed either by your team or you can go to other experts in your field. I suppose it depends on how complex your project is. For the project that I talked about with a bunch of physicians where we were measuring health literacy, once we developed our items, we actually developed a tool and we sent because we had a panel of experts from across the country to help us with this. We sent them the item pool and we asked them to rate every single item in terms of whether or not they felt it was defining the construct. We had 4 subscales, so it was the 4 subscales. We asked them if we thought that really defined the construct. Then we asked if the items really defined the subscales. Did the subscales totally make up the construct? And then we also asked them to look for whether or not our items were clear. I've also worked with groups where we've done cognitive interviews with respondents. So if you're going to be creating a survey that's for students, I mean, you really may want to sit down with a small group of them and ask them if things are clear to them to make sure that everything's clear before you actually go out and collect your data. Ultimately, though, at the end, it's really your decision to decide whether or not you want to use the advice that you're given from those that you ask advice for, right? I mean, because sometimes people say things and I really think you should have done this, and you're like, well, we've already discussed that in our teams and we've decided that's not important. It's also a really good idea to pilot your survey or your scale if you can with a small development sample. This will then allow you to actually look at the statistical characteristics of your items and make changes before it actually goes live. At this point, sample size is important because you don't want your item level statistics to be biased. And so a lot of times this isn't very feasible to do. I mean, you just want to develop it and use it for the population of respondents that you want to give it to. So if it's not possible to do that, the cognitive interview process works really well, and then you'll just have to do all the statistical analyses after you collect all of your data. Reliability is a psychometric characteristic of your scale. There's many different forms of reliability, but in most instances, I think what people are concerned with is item homogeneity or internal reliability, which is called Cronbach's alpha. And it's a measure of internal consistency. And think about this for a minute. What it's measuring is the item homogeneity of your scale or subscale. So basically what it's saying is how consistently are people responding to the items that are supposed to be measuring the same thing. Now, that's an easy thing to sort of say, but I find, again, when people try and do it, it's not such an easy thing to do. You really have to look at your items as a whole, and you have to say, okay, is someone, let's just pretend again, think about that construct map and think of the continuum and think of that person who is strongest, has the strongest skill. Is that person going to strongly agree or agree That's sort of a personal thing. I never strongly agree with anything. But will they agree with all of those items? If the answer is yes, then you've probably done a good job. But if you're like, well, no, if they might agree with these, but they might not agree with this, then you're really measuring two different things. So this is why, to some, it looks like your item, it may to some appear as if your items are redundant. You don't want them to be redundant. You want them to get at various facets of the construct that you're trying to measure. So basically, what you're looking for is very high item correlations, so relationship between how people are responding to the items. So this is because under the classical test score, under the classical measurement model, we say that all measurement is due to two things: variability in the true construct and error or noise. And what happens is that Cronbach's alpha basically partitions your item level variance into two components. And I'll show you what the formula looks like. No, I won't, because I'm on a Mac. Okay, no, I won't. There actually, if I do have a formula here, I'll explain to you what it is. It's just really 1 minus the sum of your item level variances over your total variance on your total measure. So I don't know why that translated that way. It's like a math form. Well, whatever. Anyway. So conceptually, that's what it is. It's the proportion of variability. What Cronbach's alpha is a measure of the proportion of variability that's due to true differences in your construct as opposed to error. Because your variability on your total, the variability on your total scale or subscale or whatever is composed of two parts. It's composed of your error variance and your true score variance. And your item level variance, which I would have been able to show you, this is actually supposed to be a matrix, it's on the diagonal, and then the covariances are on the off diagonals. And so if you take the item level variance, that just represents the proportion of true score variance. And there's another formula that you're not going to be able to see, so that's okay. But I think these slides will be made available to you. I sent them to Z, so hopefully you'll be able to see them on the slides. So having more reliability increases the statistical power of any statistical test that you're going to do, because as you know, in any statistical model, you have an error term as well, and measurement error is incorporated into that error term. There's other forms of reliability. I don't necessarily think that those will be pertinent to what your teams are developing. I do know that there's a lot of confusion by non-psychometric types about what the KR20 and KR21, my physician colleague said, well, why aren't we using KR20? Why aren't we using KR21? I'm like, it's the same. It's just a calculation thing. So really, Cronbach's alpha is probably what you'll need. So validity is something else that's a very important property of any sort of measure that you're trying to develop. And validity and reliability are very much related in that a measure can be reliable but not valid, but typically if you have validity, you'll have reliability. So validity is really important. The inferences that you're making based on the results of that measurement is what's being validated, not actually the measure itself. So there's three types of validity that we typically talk about, and the one that most people are typically concerned about is construct validity. So how valid are the items or the scale in terms of measuring the construct that you've defined? And construct validity is obtained by looking at the theoretical relationships that should exist between your scale and other existing measures or variables. Construct validity includes both empirical evidence and logical evidence. Logical evidence includes face validity. So the study that I told you about where we asked a bunch of physicians how well we were measuring the construct was a way for us to empirically gather data that helped us to look at the face validity of that. And empirical evidence can also be obtained by making predictions about how your scale should behave in terms of other scales that exist or in other various test situations. So here's some procedures for assessing construct validity. You can look at correlational studies between your measure and other measures that exist. So if you have developed some new measure of self-efficacy and there's an existing measure of self-efficacy out there that wasn't suitable for your purposes but has been validated, and maybe you even used some of those items but changed them for yours, you can correlate those and show that the relationship is high. If it's a perfect relationship, then you don't really need your new measure. You could just have used the measure that existed. But you would expect it to be higher than the relationship that your new measure has with some other different construct that you're being measured. And you can sort of consider including these validation items in the measure that you're administering your new measure. You can also look at construct validation by differentiating between groups. So for example, if you have a group that you know is low on the construct and a group that you know is low on the high on the construct, you would expect there to be mean differences on your measure. And then you can do a factor analysis, either confirmatory or exploratory, and I'll talk a little bit about this at the end. Although factor analysis is very, very sample dependent, and so therefore you really should include cross-validation. So if you run a factor analysis on a sample of, say, 250 people, and you run an exploratory factor analysis, and you get a factor structure, that doesn't necessarily mean it's going to work with another group of examinees. It's all very dependent on the input, which is the correlation matrix of your items. Another type of validity is content validity. This is very, very important in achievement tests, but also might be important in terms of any measure you're designing to make sure that you've gotten all the content, that your items reflect the whole content of domain, because your items are supposed to be a subset of items that come from that population of items. Content validity is typically based on the subjective judgment of individuals. So, and again, this is something that we tried to do empirically in that other study where we asked people to judge whether or not the content of our items was good. Criterion validity, I'm not so sure is going to be so useful to the teams as you're going through your work, because criterion validity is related to some external criterion that you're trying to predict. So the example that's always used for criterion validity, well, which actually might be important to this group, is whether or not to predict whether or not you do well in college. So for college and career readiness, I guess that might be important. But the truth of the matter is that criterion validity studies typically are not done in the appropriate manner, because typically we use those scores to actually admit people into college. So we have we have a reduced sample. So typically, what you really want to do to look at the predictive validity of your, or the criterion validity of your measure, is to not use it to make any important decision, and then see what would happen after the fact, after you've admitted everyone, or after you've, and to then see if it would have been useful, because then you don't have a restriction of range. And that's what I'm talking about here. So criterion validity relates to both predictive and concurrent validity. Typically, concurrent validity studies are what's conducted, and it's why a lot of people say college admissions tests are not really that predictive. But what people forget is that there's a big attenuation because of the restriction of range. Once you think about these, once you go and collect your data and think about how you're going to look at the validity of your measure, and then you really need to look at the item analysis to look at the psychometric properties of your items. And this really should be done at the overall level, and it should also be done at the subscale level. And I'm going to give you an example of a table that I typically have my students fill out when they pilot their scales. So this should be done really prior to doing any other sort of analyses, especially factor analysis, because the input to a factor analysis are your items. So if you have items that aren't functioning well, anything that you do after that is not going to be functioning well either. So you want to make sure that you do item level analyses before you add your items together to come up with a variable. So there's several things that you need to look at when you do item level analyses. You really should look at the frequency table of responses to your response options, because if you see that everybody is strongly agreeing or agreeing to your items, you know you're not adding to the variability of your scale, so you know your item's not functioning well. You also should look at the item discrimination, which is the correlation between how one responded to that particular item and the total score, excluding that item, on either a subscale or the overall scale. You can look at the item variability, because again, we want to maximize that. And you can look at item mean scores, although especially if you have like a 5-point response scale, you can get the same mean for very different patterns of response options. So it's really important that you have that frequency table of response options. And then you should look at what happens to the reliability if you get rid of an item. All this is done really simply in SPSS. Because if your reliability would go up if an item is deleted, then you'll know that actually that item is, you'll see it in multiple ways. You'll have multiple indicators. You'll see that the item discrimination isn't good. Then you'll see the reliability would go down. So you have multiple indicators that indicate that your item's not functioning well. So here's a table that, and once again, my mathematics isn't coming out right, sorry. But here's a table that depicts, in my opinion, a much easier way to organize all of the results of those item analyses instead of table upon table upon table of frequency tables of response options. So I never want to look at all that for my students, so I have them put it together in a table like this. A, B, C, and D are representing actually the response options. I just picked a 4-category scale. I think that was supposed to be the mean, the standard deviation, the reliability if the item was deleted, and I don't remember because I can't tell what that is, so sorry. And lastly, the other thing that you might want to consider doing with your measure is factor analysis. You would want to do this if you are measuring something that has subscales to it. This can be used to determine if the items on your subscale sort of cluster together. The important thing to remember is that the input to a factor analysis, and I've said this multiple times now, is that correlation matrix of your items. So if you delete any one of your items, your factor structure is going to change. The other important thing to remember is that there is an infinite number of factor solutions if you're doing a exploratory factor analysis because the space itself is indeterminate. So I'm not the biggest proponent of factor analysis unless you do it in a confirmatory way because you have some theory. But if you're going to do it, I do in my class, it's too much for me to go into structural equation modeling with them. So we do exploratory factor analysis, but we do it in a confirmatory way. So I want them to see if an exploratory factor analysis comes up with the factor structure that they hypothesized. So the way factor analysis works is that the algorithm assumes that it's an iterative process, and it assumes that the first solution, that only one factor explains all the variability in your data. And then it iteratively looks to explain more and more variability. The factor structure that will explain all the variability in your data will be the number of as many factors as you have items. So typically we want a factor solution that's much smaller than that. So what happens is to test this assumption, and I don't think I'm going to have time to go into the details of this. I only have 3 minutes. So I'll leave it at that. I do have something else I want to say at the end, just conceptually about factor analysis. So you'll have the slides. You can read this on your own. I want to talk about actually how you determine what the optimal factor structure is if you're doing it in an exploratory way. And the way that you do that is based on statistical criterion if you're doing confirmatory factor analysis. For exploratory factor analysis, you're typically doing it based on the eigenvalues. So a lot of times my students will present me with a solution and I'm like, I want to see the eigenvalues. Because if you're doing it in SPSS and you're just using the defaults, SPSS will give you a number of factors that are based on eigenvalues greater than 1. But obviously, if you have an eigenvalue that's 1.04, that may not really represent a factor. So I always want to see the eigenvalues. You should also not really be afraid to force the number of factors. So that's what I tell my students to do. I said if you expected there to be 3 subscales, see what happens if you have a 3-factor solution. And then when you look at those factors, see if they're grouping together the way that you thought they would. If they are, then you've probably done an okay job. If they're not, then maybe you should think about why that is. So I always think that the final solution should be based both on your theoretical considerations and the statistical criterion, but not one over the other. That's it. I finished in 2 minutes, and I'm going to make my plane. And I have left a little bit of time for questions. So any questions?
Could you just, off the top of your head, a measure of item level variability?
Just a standard deviation.
Okay.
Yeah, I mean, yeah, you just do the standard deviation.
Awesome. Thank you.
Mm-hmm.
I just was wondering about your thoughts about translating survey items to other languages and
that's
the statistical validity of that.
Okay, so that's a really, really good question. So I didn't really tell you about what my particular research is in. My particular research actually is in item bias and test bias. All my publications have been in the area of differential item functioning, which is sort of the psychometric term for that. And you can do studies to see if items are functioning differentially if they've been translated. And that's done all the time with achievement tests that are translated into other languages.
Great presentation. One thing I'm kind of concerned about the career measures that are freely available online, like MACCIS, Naviance. Well, Naviance career cruising, you have to pay for those. I guess what I'm concerned about is what I see, because I know a number of our teams will be using MACCIS and those kinds, and I think they have great utility, but it seems that they take, as I understand it, more of an ideographic versus a norm reference approach. So it's like comparing the person to themselves, and as opposed to, and not an external reference point. So it seems like they ignore things we know about. I know you've done some research in this area: gender differences, socioeconomic differences, racial, cultural differences, and you'll get, kids will get scores back that'll be like 22, 21, 19, 18, and then they'll say, well, that's RIA on a Holland theme, and then somehow the 18 doesn't take into account measurement error or anything like that. I don't know if you have any concerns about.
Yeah, we talked about this a little bit last night, and I find it to be a very interesting problem. I have done some research in the past on the strong interest inventory with a colleague of mine at Milwaukee, and we did find some items on that measure, which is paid for and very widely used and very, people consider it to be a very good measure. And we did find diff, both in terms of gender and in terms of race. And so that, and I never realized that people are just using things ipsatively. I think that those measures are actually based on data and collecting data from people that are in actual jobs doing those things, and these are the things they like to do. So I have a problem with that. I mean, maybe that's something that, as part of my work with this project, we could sort of try and think through and see if if people are using it, why not try and norm it in somewhat way, to see what sort of the average scores are and how you are scoring, true standard deviations above the average score of anyone else in your peer group or something like that. That would be a really interesting project. So maybe we could work on it together.
I guess I can ask another one. Do you have, what's your current understanding of, I guess, the social, let me give you a little context before I ask the question. For a number of reasons, both, I guess, valid and just for a number of reasons, sometimes self-report data are looked at in a different way than perhaps more direct or observational data. What's your sense of the literature where where we might be in terms of the social validity or just generally the validity of self-report data in general? Because it's something that can quickly just sort of...
That's a very good question, and that a lot of existing measures have like little truth scales or validity scales built into them to make sure that people are answering things truthfully. Like I think the MMPI has something like that. It's called the truth factor. I think it has a lot to do with the directions that you give to a respondent. So I mean, it depends on how important they think this is in terms of their own, how you're going to judge or evaluate them. So if they think that if they don't do good on this measure, you're going to judge or evaluate them in some bad way, well then they're more likely to not respond truthfully than if you're like, I just really want to know how you feel because this is going to help you and I'm going to help you in this decision and it's really important that you're honest. And I see an X, it's time for me to quit because she wants me to make my plane. But I mean, I think it really has to do with how the person perceives the results of that measure are going to impact your perception of them, if that makes sense. Okay, well, thank you. I have to go. Yeah,
we'll get the slide thing figured out. Yeah. So let me just put a couple of examples to some of the things that Cindy just said. Specifically in relation, I want to focus really right now on how are we developing items. And the reason why we wanted her to, and she'll be with us, so as we go through this process, it's not like we will be able to go back to her and ask for some more guidance and more details as we go through. But let me give you an example of how I've been developing measures. So I have a measure of resiliency, and we wanted to bring it down to the elementary version. So we went out to Las Vegas and met with 7 classrooms, our groups of teachers from different class levels throughout a whole day. And we sat there and went through every single item. And let me just give you examples of things that come up. You like to use the word parents? Not all kids have parents. You want to use the word family? Not all kids have family. So we have to talk about the people you live with, which changes my family connections to a whole nother dimension. You want to talk about your home? Not all of our kids have homes. So we have to talk about the people you live with and where you are living, right? The only way we know that is because I'm working with teachers who are working with those students. It keeps us understanding the complexity of what's happening. And so the idea of wanting to slow down and say, how do we design the items to really be reflective, not just of the construct, but of the reality, it happens, as far as I'm concerned, with those educators. And they are in the position to really understand how this looks. Why do students take it seriously? Because it's the degree to which it represents their reality. And so at some point, we can think in our laboratories of all these great items, but they may not match the phenomenological experience of the individuals we're studying. When it does, they take it seriously. When it doesn't, they know, well, this isn't about me, and they're going to blow it off. You see where we're going? This is the critical part. All the stats, all the formulas she gave you, we can do that. SPSS helps. Within our team, we have plenty of people to walk through it. That's the easier part. But the problem is, if we get bad items, it's over. It's done. Doesn't matter how much data we collect. So there's really something formative, and as I feel, the best part of the work is when we're sitting and we are working together around understanding what the construct is, what it is we're studying, what's the theory behind it, and they're understanding it, and they're in the same worldview that we are, and now together we're constructing some of these items together. That's a very powerful place. And like I said, we'll have all the support systems to walk through this. But I wanted you to be thinking about this as a very, very important phase of our research and not something that we're going to walk through very quickly or just assume. We know, those of us that have been working with urban populations and in culturally diverse populations, how many measures do not reflect their phenomenological experience. We don't want to recreate that. Okay? So that's the kind of piece on it. I know this was pretty heady. I told you she's intense. She's good. She's got lots of stuff. A lot of big words. I understood a few of them. A lot of big words. Eigenvalues, that'll be on your quiz. But I just wanted to give you a chance to just also ask any other questions you might have based on that, like, oh my gosh, you just said I need to do this. How am I going to do it? We can talk through some of those. But I also wanted just to give you some real life examples of really why this is such an important piece.